Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Huyer here, so I'll turn it over to them for some brief remarks.
Good afternoon, and I'm pleased to be joined today by Dr. Huyer, who will provide us with comments and recent trends on outbreaks in the province of Ontario over the time since Monday. So, as always on Monday, we look back over the week, or we look back at this time of day on Thursday, back over what happened since Monday. And we have had an additional 5,254 cases of COVID-19 reported. So our 7-day average is now up to 1,769 cases. That is up from 1,427 cases a week ago. So the trends continue to go up at this time with the overall numbers. The majority of the cases reported since Monday, 87%, were concentrated in the red and lockdown areas of the province. And when we broke it down even further, 57% of the cases since Monday are in the Toronto and Peel, so that even today's number, about 1,000, are from those two areas. So we have done a lot of testing, and the testing numbers are up and are continuing to go up. So that we've done 131,709 tests with an average of a positive rate of 4.7. So that positive rate started high at the start of the week. It's coming down slowly back to where it was approximately a week ago. So we see this undulation week in and week out. And today and tomorrow, of course, are our largest numbers, and going into early Saturday because they indicate the testing done on Wednesday, Thursday, and Friday, which are some of our highest number every week. Hospitalizations have increased also, and we have anticipated that as your cases go up. Delayed, you get the hospitalization rate picking up, and then followed by that with ICU admissions and those on ventilator, and then unfortunately death. So our hospitalization, 66 people were hospitalized in this time period today, and 20% increase over last week, 556. And according to Critical Care Services Ontario, 203 people are in ICU, which represents a 34% increase over last week. And as you know, we are looking at how that affects and impacts some hospitals that have more ICU patients than others, because our total last week was 151. Tragically, since Monday, we had another 56 Ontarians who have lost their lives to COVID-19. And these are not just numbers, they're individuals, and our condolences go out to the family members and those loved ones with them. We don't want to forget that, and we want to make sure we cover there. I want to now hand things over to Dr. Huyer for some remarks about outbreaks. So over to you, Dr. Huyer.
Thanks very much, Dr. Williams, and good afternoon, everybody. A brief update today, and we'll pass back to Dr. Williams in a minute to provide more opportunity for questions. We continue to see a large number of outbreaks reported on a range from a day to day, over 20 and upwards as high as 40 over the past week, all scattered across the province in various regions, including locations that was rare to report outbreaks in the past. Over the past 30 days, 845 outbreaks, and over the 7 days as of December 1st, 233 outbreaks were reported. The range is commonly about a third or a little less than a third in the vulnerable sector, which is long-term care homes, retirement homes, congregate care settings, group homes, hospitals, about a little less than a third in schools and daycares, and then about the rest split between workplaces and public-facing locations such as restaurants, short-term accommodation, places of worship, and also recreational fitness as some examples. And the workplaces are very broadly described, but I think clearly all of these represent the widespread nature of the community spread. And when you have such widespread nature, you will enter into your workplaces, into schools, into long-term care homes, where in fact the then can be spread within that workplace if in fact people don't maintain proper distancing, proper precautions, proper hand washing, masking, and other steps that need to be taken. And that clearly is what we've seen through different workplace outbreaks and other outbreaks in other settings. So with that, those large numbers, I'm going to pass back to Dr. Williams.
Okay, well, thank you, Dr. Huyer. And I think that only backs up the concerns we have with the numbers, and as we talked about last week with Dr. Brown, and the term he used that seems to be coined quite often is precarious. And we see our numbers this past week, while we were in the low 1700s the first couple of days, our number today is over 1800, but we understand, and you saw in the data, there was delayed data entry from one of the health units, and that means that we had 3 days of data. So our numbers rather than being in the low 1700s for the first 2 days, we're probably in the mid 1700s. And today, instead of being 1824, is more in the upper 1700s. So, well, that doesn't give us much solace because those are a lot higher. As I said, the overall average was higher than the previous week. That means these trends and directions, while on a per capita basis, we may say, well, we're better than some of the other provinces at this time. It doesn't give us much reason to be sitting back and doing nothing. We have to be concerned, and we are certainly watching and concerned about our other provinces around us and their issues, and hoping that they will be able to bring it under control as soon as possible. And we only want the best for them in that regard, the same as we're trying to do our best to keep it under control here. So this is a pan-Canadian problem. We all need to be pulling hard on this one at this time to keep these numbers down, not only for the protection of yourself, your loved ones, especially the vulnerable ones that you have access to, but of course into protecting the healthcare system. And as we said, our number, as Dr. Brown was alluding to, concerns as we pop over 200 in the ICU. That is not every ICU, that's just overall in the whole province, but that means some hospitals are having issues and concerns about maybe having to delay some surgeries or allocate them to other facilities. So the system is coping, but it doesn't mean some of the institutions are not having some struggles and issues at this time. So these are real issues. They're not just hypothetical. We have to drive at that and try and get those numbers back down again. And I know that with fatigue and things, people are trying to work that through. And in spite of seeing some individuals and groups doing things less than compliant, I still feel a lot of Ontarians are being adherent and doing their best to hold the line on this. I think we need to keep reminding each other to continue to do that. Some people are getting notifications through their apps and are dealing with those aspects and how to handle that. And so we're using all tools we can to inform you of what's going on in your jurisdiction. That's why we have the framework. That's why we're letting you know what's happening. We'll have some changes coming up, will be announced tomorrow. And those trends and directions are upward, with some greens going to yellow, yellow to orange, and orange to red in that aspect there. So we're showing that what's in your area is real and happening. Even some in the far north are moving into more intense colors, which means they're not remote from the issue, and it's happening in their own backyard. And the same high-risk behavior is noted in a number of areas. Just because you may be in green at the moment, the high-risk behavior is not actually applauded, because that means it opens you up any time. If there's any introduction into your community, it can rapidly spread, especially some of the smaller centers, and put your numbers up very high very quickly. And so it doesn't support careless and lack of adherence to public health measures, which, as you recall, even the green zones are required throughout the whole province. And we have to keep that in mind. Just because you haven't had that doesn't mean you won't, and you're not excluded from getting that. And so you have to be vigilant and diligent in your adherence to the principles. Also, with those numbers going up, we're seeing impacts greater in our long-term care facilities. We're trying to hold that off. Our teams are working really hard in many different ways to protect those ones in those settings there. We're using our different methods around the constraints of the framework. And I know it's an ongoing challenge for Toronto and Peel. They're in the lockdown, and we're working with everyone to try and help them stay at the task, support them any way we can, and deal with that. It also means that there's more cases in those areas that have high percent positivity of children and staff coming to schools with positive, mostly a lot of children. And yet some of our processes and stuff there, we still have only, I think, about 4 schools in closure at this time. Some are administration closures as well. And so this is a thing that challenges our systems to hold the line and to protect these desired and essential services as best as possible. And we're working with each jurisdiction to assist them in this manner, along with our health units, who sometimes are getting overwhelmed with case contact, even in our outer zones. And we're moving more case contact resources to them, as well as enhanced enforcement around the Section 22 orders and other things. That it's saying is that these are not just sort of nice things to put out. These are actual requirements that you have to adhere to, and people will be approached by law officers and sometimes by peace officers to say this is not allowed, and sometimes you may be rendered a fine in regard to the adherence to the ROA regulations. So this is a serious matter. We need to look at it. We only have to look to the provinces around us that are struggling with issues. We may be at this time doing okay. We can quickly move into that very fast. So we have to not coast. We have to really press hard and stay vigilant on this at this time. So stay focused. We still have some time left, but we have to really work hard at this and get those numbers down. We still like to see lockdowns go back down to red down to orange, and so forth. It is achievable, it is possible, but it takes everybody, all the time doing it consistently and persistently throughout the whole time. So with that, I'm going to hand over to media for questions.
We'll go to the phone lines. Just
Dr.
a
Huyer.
reminder, one question, one follow-up. Over to the first question, please.
First question comes from Antonella Artuso at the Toronto Sun. Please go ahead.
Thank you. Hi, doctors. At what point in a vaccination program would you expect to begin rolling back restrictions? Is there a vaccine threshold that has to be met?
So it's a good question. I know Dr. Huyer may want to weigh in on it too. At our special advisory committee at the national level with our other chief medical officers of health, with the federal, provincial, territorial group, and addressing those issues as we are all trying to say, how will it be rolled out? And Dr. Huyer probably has some comments. And if so, if and when does that mean individual? What can that mean for you individually? What does it mean for you collectively? What does it mean for the population? All these are ones we are seeking to answer. We hear different numbers tossed around. Early to say with any assurance exactly what that number might be. We hear the term herd immunity, and we hear numbers tossed. And we're trying to get our scientists in that to drive into that to give us some exact ideas. Our challenge will be to get the vaccine as soon as we can, to make sure it's as safe as it can be, to make sure it goes out to the right people at the right time in the right way, as efficiently and effectively as possible, to make sure we deal with all the areas in the right way according to our team. And I know Dr. Huyer is going to talk about that right now and how we're going to progress on that one there. So it is a full team, a big team, and they're working fervently at this time, working with our federal counterparts to ensure we're moving ahead as assertively as we can. So over to you, Dr. Huyer.
So thanks, Dr. Williams. This is all learning for me. Dr. Williams has been teaching me, and I've learned from others, including Dr. Yaffe, around this. I know General Huyer is actively working as the lead of a task force to try to sort through how all of those things can occur. I think there's lots of learnings, and I think it's so early because the vaccination process has not started in Ontario. It did start in England today, as I understand, and so there will be early observations from England, and that will help likely to inform the approach and the understanding of what will happen in Ontario.
Follow-up?
Thank you. This is a separate issue. The long-term care sector has asked for rapid testing by the holidays, if possible, to make it easier for families to visit residents in nursing homes across Ontario. Would this be possible?
So I'll start off. We know that the long-term care IMS group have been working very stridently with our testing group to look at what kind of methods we can bring in a timely way to make sure that it can be delivered consistently, persistently throughout the time. To do with rapid turnaround of testing and to make sure that quality processes are put in place to inform staff, essential visitors, and administration and family members of those that are using the long-term care facilities. So this has been a strong priority, as you know, from the Premier and others to make sure we put the wall of protection, if you may, around our most vulnerable citizens. And this is, I can tell you, has been working at full force, and perhaps Dr. Huyer has some comment to make. No, he said, okay, I've covered it. All right, so it's stay tuned, and they'll have some announcements further on that regard.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hello, doctors. Just getting to what you were saying there about some areas going to move up. I know that you didn't mention any areas are going into lockdown, and I have seen the chief medical officer for York Region on TV today, as well as the mayor of Vaughan, saying they don't think they need to go there. So, are you comfortable with that?
So, Rob, we have, as our process is, we go over the numbers with each of them and talk to all the medical officer of health, including to Dr. Kurji, the medical officer of health from York Region. We go over those ones, and then we put together some recommendations based on that, and we move those up to be considered for our minister and on into the cabinet for decision making. So we hope to have we will have the answers for that as of tomorrow once that has been worked through the proper approval processes, because it is a ROA, or is a part under the authority of the cabinet to make those decisions, because it is a part of the Ontario Act that covers that aspect.
Follow up?
And just what is your general thinking about the way things are going in Ontario outside of the GTA? How many, roughly, how much worse is it getting out there in terms of spread into the regions? And, I'm thinking of what Dr. Huyer said is you're getting outbreaks in areas where they have been rare or non-existent in the past.
I'll start, and I've Dr. Huyer to complete. We're seeing a number where we used to have in our main 3 or 4 zones 89 or 85% of the cases. That has spread out, and some of our outer health units, some who have moved into the red in the last week or so, are seeing, for them, large numbers. They're seeing it in different types of areas, different settings, and Dr. Huyer will comment on that. Some are being pushed hard to keep up with case contact management. So these are not small issues, and that's we see this ripple effect going out to the wider sector of the province, even in the far north. And so no part of the province is distinctly removed from this challenge that we're facing right at this time. And so that's why we really have to clamp down and see if we can bring it down as fast as we can to keep our systems up. But I'm going to ask Dr. Huyer to comment on how he sees the issue rippling out through the province.
Yeah, absolutely, Rob. Thanks for that question and highlighting this. This is really widespread across the province. There are cases that are seen in many of the health units, not each an individual ones, but there certainly are spread much more broadly than it was before. When we look at the public health units, generally 25 cases per 100,000. Certainly Peel, Toronto, York, Waterloo, and Hamilton are higher than that, but it is certainly notable that we see it in a variety of places. And in maybe 3-4 weeks ago, we would say in the north there were no cases. We now regularly report the cases in the north. We also see not only cases, but we're seeing increased range of outbreaks following the trend that we did see in Toronto, Peel, Ottawa, where first was long-term care homes, and then it was other settings, and then into workplaces. And we've seen that same pattern occurring in other jurisdictions beyond the areas of increased case counts. So it is certainly concerning and unfortunate to see it continuing to spread across the province.
Next question.
Next question comes from John McGrath at TVO. Please go ahead.
Hi, another question, I guess, about vaccines. I know that I think it was Pfizer just started testing on children under 18, but it seems likely that among the people who are not vaccinated until later next year could be school-aged children, and I'm just wondering if that means that the current set of public health measures in Ontario schools could very well last into not just the fall, but potentially into the winter of next year. Is that part of your planning scenario?
Well, it's certainly a good question, and thank you for asking that, because what you're alluding to is that we have the one product, Pfizer. There's, as you know, 3 others in the offing coming forward in there, and there'll be others following suit. So how fast we can move and vaccinate everybody is to be determined, what's appropriate for age groups, et cetera. So all this is, I think the vaccine companies will say this is lightning speed for them to get products out and running, and safe products. That's very important for them. and it's important for us to have that documented for all groups, including age groups and including especially for children. So if they're undertaking that assessment now, that's good. Our problem, of course, most of the issue if they're concerned about is our vulnerable areas, and those are most prone. That's our adult populations and various things. So we got to make sure they're covered. But everyone we would like to be concerned about. So, how we would be in the summer going into the next fall. I'd like to think if we got lots of different companies and stuff and good products, we could get a large group vaccinated. That would change things considerably. But it's still early days, and we're going to start this process as soon as we can and to make strides. Everything we do is a step in the right direction. But again, if we're going to be doing our children, we want to make sure that any product that's coming out is going to be safe for the age group appropriate, and we have to be satisfied that it meets those criteria before we'd undertake to do that program writ large. So I can't give you a distinct answer to that. We have those measures in place if we need them. But as we've noted, most of the time with our schools, we're seeing tends to be the spread in the community among the adult, older, or young, well, to some extent, the high school, the younger adults around, and then that gets picked up and brought in the school by the children. So if we get the adult ones down, that might help our schools accordingly, but we may not be able to back off all our preventive measures, certainly in the spring, maybe in the fall, but it would be nice not to have to, but we're going to keep on top of this.
I can say what's really impressive and tremendously positive is the work that's been done to develop these vaccines. Tremendous investment, tremendous science, tremendous amount of study and evaluation to be able to move a vaccine into production. And people often say, well, is it too fast? Well, my understanding is that the numbers of the size of the trial is still the same number. It's just been compressed into a greater number of people being tested in a faster period of time. So it's still the same amount that would often take over a year, but they were able to recruit and to bring together a significant number of people that would meet the safety standards that are always in place for vaccination. Same process is being followed. It's being followed in a way that has been done with greater numbers more quickly. And similarly, there's focus on the younger population as they continue to roll out the vaccine, is the understanding that I have. And as Dr. Williams pointed out, incremental vaccine as the more doses are available clearly will have benefit and clearly will reduce the spread through the communities, and therefore would reduce the number of people that would have the infection, including children who would be living with those adults who may be protected from vaccination. So I think, as Dr. Williams pointed out, it is early, but that's the way that things can be looked at and thought of, and hopefully the plans will follow that pathway and that journey.
Follow up?
In terms of, I know these details are still somewhat in flux, but some of the early speculation based on some of the numbers coming out of Ottawa was that Ontario would get enough doses to inoculate nearly everyone, or perhaps everyone in the highest risk groups, people with compromised immune systems, long-term care residents, and frontline healthcare workers. And I'm wondering if that is still basically part of the planning scenario, at least until March, or whether those numbers are wrong and, in fact, we will not be receiving that many doses.
I think General Huyer and the task force are actively working on that and sorting through those numbers, and I think it's difficult to say unless, Dr. Williams, you have more insight into those numbers.
I would just say the way it works with our provincial procurement, working with the federal government, and we sit down at the tables with our FPT partners as each allotment comes through, and that it's done on a certain formula and basis because we're in this together. And we respect that, and we are all seeking to get the same level of coverage that some are going to put targets for us of all categories and how to get there. And as you get this one, then it's sent out, and another one it's sent out, and that. And it doesn't, one province gets it and the others don't. It doesn't work that way. And we have to be respectful of that because, as I said all along, while we're doing this province by province and territory by territory, it's a collective action working with our federal counterparts because in the end we want the Canadian morbidity and mortality down. And so we work together in partnership with each other and respect the unique challenges that each has and how to best handle that and be considerate of that.
Last question.
Last question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much. I had a little bit of a technical problem, Dr. Williams, so I apologize if this is addressed in Rob's question, but just for clarification. So did I hear correctly that there will be certain regions moving up in the color-coded system, but not in lockdown tomorrow? Is that correct, or there will be recommendations to Cabinet for that?
What I said to Rob was that there are ones moving up. I didn't say anything about any aspect to lockdown. Doesn't mean there is or isn't. I said that we have to give that recommendation up to our to the minister, who takes it to Cabinet accordingly, and we can make those announcements tomorrow. I just said that a number of them are moving up in the color codes in the framework, different jurisdictions, green, yellow, etc.
Follow-up, and this is the last question.
Thank you, Dr. Williams, for that. I appreciate it. And Dr. Williams, my other question is this with regards to vaccines. Are you going to be making any recommendation to Cabinet over whether any portion of the rollout should be mandatory, whether it's maybe just for long-term care or certain sectors? But will you, as the Chief Medical Officer of Health, in any way make some sort of mandatory vaccination recommendation?
So similar to all our immunization programs in the province of Ontario, and we have some special acts related to that, like the Immunization of School Pupils Act, etc. We can't force someone to take a vaccine. That's clear, and because we want to make sure that people say they only would want it. And we want to make sure we have all the information they need, as well as all the safety information, etc. What we can do is to say sometimes for access or ease in getting into certain settings, if you don't have vaccination, then you're not allowed into that setting without other protection and promote materials. So what may be mandatory is proof of immunization or vaccination with a proper product in order to have latitude and freedom to move around in certain, like to access into long-term care facilities or go to the hospital, different things, without wearing other types of form of personal protective equipment, etc. Same as with school attendance. It may be much like our other vaccines. We haven't gone there yet, but we would make it mandatory for access in, and sometimes being excluded if there's a risk or a hazard going on. So it's more of facility of movement and around that, not that someone is going to be forced to take it against their will. We don't see there's a need for that because we think anytime our vaccine products have been proven historically to be the best thing we have. And we've seen that time and time again. You've heard testimonials, whether some people in the past saying, where polio was a big thing and people will live for many years in fear, it's not. Why? It's not gone. It's still out there. We're still trying to get rid of it. We're still trying to vaccinate against it. But we don't have those cases in Canada and many other preventable diseases. So it's highly effective and the safety is exceptional. So we still want to make sure we continue that. We want high quality vaccines, very effective, very safe, and monitor everything and to encourage you as Canadians, as Ontarians to say, this is what you would want to have, and we want to make sure you get it in the way you would like to get it, in the timing of it, and with all the information you need to make the best decision.
Thanks, everyone.